Well, diversity has a tremendous role to play within our mission at the California Endowment. It's a double bottom line investment for us. On the one hand, it is a social justice and moral imperative because our organizational values underscore the importance of inclusion, of equity, of social justice. But on the other hand, and equally important, it's a strategic imperative because we see that by invoking diversity and using diversity and inclusion in everything we do, we are a more effective and higher quality organization from a service delivery standpoint. Diversity and inclusion help us to recognize those communities and those grassroots leaders in those communities, not just as recipients of grants and recipients of services, but as vibrant actors, as vibrant leaders, as dynamic leaders who have their own ideas, who have their own passion, their own creativity. And if we're not being careful to paying attention to the issues of diversity and inclusion, we lose those ideas, we lose that creativity. So it really helps us to be smarter about our grant making in addition to being more inclusive. For the California Endowment, the journey around the importance of diversity and inclusion really came from our board of directors. Our founding board of directors had a very strong sense of values around social justice, around equity, around inclusion, and around diversity. And when you have that kind of commitment at the level of the board, you actually don't need a lot of policies and procedures and guidelines to advance diversity. It flows naturally through the rest of the organization. It becomes important to the CEO. It becomes important to the members of the management team. It becomes important to the staff. So having diversity and inclusion as a core value is the best operating framework to move diversity forward. Yeah, there are the best practices, and there are the cutting-edge ideas, and there are the policies and procedures that can strengthen diversity and inclusion. But there's nothing like having it as a core operating value, and having everything else flow from that framework. I think the biggest challenge we faced along the issue of advancing diversity is the outdated and poorly equipped definition of diversity around being politically correct. That diversity is a nice thing to do if you have the space and the time and the luxury to do it. That old operating definition of diversity is outdated and doesn't serve a good purpose. In healthcare, for example, we now know that healthcare organizations, be they HMOs or community clinics or hospitals or health systems, have demonstrated that you can improve the quality of healthcare and improve customer responsiveness in healthcare by paying attention to issues of diversity and cultural competency. So in healthcare, we see that diversity has an important role in quality of care. It's no longer just a nice thing to do. And I think we're finding the same in philanthropy. It's important for the quality of services, it's important for the effectiveness of the programs we develop and deliver. And for us, our greatest success is that we see that communities that we're responsive to, that are dealing with very distressed economic and impoverished conditions, because we pay attention to the diversity and inclusion issues regarding those communities, we see that our programs in children's health insurance coverage and childhood obesity reduction, in mental health services, we get better results as a result of being attentive to issues of diversity. The way we try to incorporate diversity on the ground, and that is with our core business, which is grant making. We have very clear objectives and outcomes that express and reflect the mission of our organization. We are trying to improve the health of underserved communities. And it is our view, and hopefully we've had some impact on the nonprofit sector, at least in California, that by taking those ideas and the welcoming of the ideas from the very grassroots level of where the problems are. If the problems are in mental health, if they're in homelessness, if they're in HIV/AIDS, if they're in obesity prevention, we really want to make certain that the solutions are authentic. And they're authentic if they include the voices and experiences of folks on the ground. Those folks on the ground are disproportionately members of color. Not always, but often. And those are the folks that have the best possible handle on the policy solutions and the programmatic solutions to the challenges before them. So by having our program staff incorporate into their vetting of any proposal or any idea that comes in, okay, well, how close is the experience of this nonprofit organization and their idea to the experiences on the ground with what those communities are really dealing with? Are they coming in from the outside, or do they really share those experiences? Does the work of that organization include persons of color and diverse perspectives in that organization? Because we know that their proposal is going to be framed by their perspectives. And if their perspectives lack the point of view of diverse California, then it's probably a proposal that's not going to work.